Welcome to Final BDS Made Easy. Describe mandibular nerve block techniques, discuss complications associated with it is one of the 7-marker questions from the subject of oral and maxillofacial surgery. Mandibular nerve, a branch of the trigeminal nerve, is responsible for sensory innervation to the lower teeth, gingiva, and part of the tongue and floor of the mouth. Mandibular nerve blocks are essential in oral and maxillofacial surgery to achieve anesthesia in the mandibular region. The techniques for mandibular nerve blocks include the conventional inferior alveolar nerve block, Gogate's technique, and Vasani technique. These techniques are vital for various dental procedures, particularly in the lower jaw. The first one is the conventional inferior alveolar nerve block. It is the most commonly used technique for mandibular anesthesia. The anesthetic solution is deposited near the mandibular foramen, where the inferior alveolar nerve enters the mandible. First of all, the patient is positioned with their mouth wide open. The syringe is inserted into the pterygomandibular space medial to the ramus of the mandible. The needle is advanced until bone is contacted at the depth of approximately 20 to 25 millimeters. The syringe is withdrawn slightly and the anesthetic solution is injected. Second is the Go-Gates technique. This technique provides anesthesia to the entire mandibular nerve, including the inferior alveolar, lingual, and buccal nerves. First of all, the patient is positioned with their mouth wide open. The syringe is aligned parallel to an imaginary line from the corner of the mouth to the endotracheal notch. The needle is advanced until bone is contacted near the neck of the mandibular condyle. After aspirating, the anesthetic solution is injected. Third one is the Vasani technique. This closed mouth technique is useful in patients who cannot open their mouth widely. The patient is asked to keep their mouth slightly open. The syringe is inserted parallel to the maxillary occlusal plane. The needle is advanced into the pterygomandibular space without contacting the bone. The anesthetic solution is injected after aspiration. Complications associated with mandibular nerve block. First one is the failure to achieve anesthesia. Causes include improper technique, anatomical variations, and insufficient anesthetic solution. Remedy by re-administering the block with adjustments. Second one is the hematoma formation. It occurs when the needle punctures a blood vessel. Prevention includes aspirating before injection and using proper technique. Third one is trismus. It can result from trauma to the medial pterygoid muscle. Treatment involves warm compresses, muscle relaxants, and physical therapy. Fourth one is transient facial paralysis. It is caused by the injection of anesthetic into the parotid gland, affecting the facial nerve. This can be prevented by ensuring the needle contacts bone before injecting. Fifth one is paresthesia. Prolonged numbness or altered sensation, often due to nerve injury. It usually resolves over time but can be permanent in rare cases. Last one is infection. Though rare, infections can occur if aseptic techniques are not followed. Treatment involves antibiotics and proper drainage if necessary. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.